What is a focal seizure? Symptoms and signs. Imagine a sudden electrical storm happening in just one part of your brain. That's what a focal seizure is. It starts in a specific area of one brain hemisphere and can stay there or spread. Unlike seizures that affect the whole brain, focal seizures are more localized. They are the most common type in people with epilepsy and can happen at any age. People with brain tumors or other brain injuries often experience them too. Focal seizures are classified based on two main things: which part of the brain is involved and whether the person stays aware during the seizure. If awareness stays intact, it's called a focal seizure with preserved awareness. If awareness is affected or lost, it's a focal seizure with impaired awareness. Sometimes, a focal seizure can spread to both sides of the brain, causing a more intense convulsive seizure called a bilateral tonic-clonic seizure. Symptoms depend on where in the brain the seizure begins and whether awareness is preserved. Motor symptoms include involuntary movements like jerking or stiffening of muscles. You might see sudden muscle spasms or a drop in muscle tone causing a person to fall. Some people experience automatisms, which are repetitive movements like lip smacking, hand rubbing, or chewing. These movements are usually localized to one side of the body. Sensory symptoms are also common. People might feel tingling, numbness, or see flashing lights or strange visual patterns. Some might hear sounds that aren't there or smell or taste things that aren't present. Autonomic symptoms can include changes in heart rate, sweating, or feelings of nausea. Cognitive or emotional signs are also possible. Someone might feel déjà vu, a strange sense of familiarity, or experience sudden fear or anxiety. Confusion or difficulty speaking can happen if the seizure affects language areas of the brain. Often, focal seizures start with an aura, which is a warning sign that only the person experiencing it can feel. This might be a strange smell, a sudden emotion, or a visual disturbance. In the context of brain tumors, focal seizures are a common symptom because tumors can disrupt normal brain activity in a specific spot. The location of the tumor influences the type of seizure and symptoms. For example, tumors in the temporal lobe may cause sensory changes or déjà vu, while those in the motor cortex might cause localized muscle jerking. Brain injuries, infections, strokes, and degenerative diseases can also cause focal seizures by damaging particular brain regions. Recognizing these signs is important for diagnosis and treatment. Proper management can improve quality of life and help control seizures. To sum up, a focal seizure begins in one part of the brain, leading to symptoms related to that area. These symptoms can include involuntary movements, sensory changes, autonomic signs like sweating or nausea, and altered awareness. Awareness can be preserved or impaired during the seizure. Sometimes, a person might experience an aura before the seizure fully develops. Because these seizures are common in people with brain tumors, understanding their signs can help in early detection and treatment. If you or someone you know shows signs of a focal seizure, especially if there's a history of brain issues, it's essential to see a healthcare professional for proper evaluation and care. Remember, each person's experience can be different, so personalized medical advice is always the best course.